but generally, I think we are looking at progressively bringing in the vaccines and to be applied to different segments of the population. As I explained during the last press conference, we will, in the application of the vaccine, we will have to take into account several factors. First is to ensure that the vaccine is effective. And the vaccine, depending on the vaccine, some vaccines may be effective for different segments of population. Some may not be effective for children, for example. Some may not be effective for the seniors. So we have to look at the vaccine, whether they are effective generally or which particular segment of population. Secondly, it also got to deal with safety issues. So many of these vaccines are new vaccines, as you know. They have been tested, but they do not yet have a long-term testing yet. We can apply them, being aware of the potential safety issues. As I mentioned in my opening remarks, that we will have to ensure that they are relatively safe and effective before we apply them. Again, the safety issues may also differ from population segments. Let's say, for example, some vaccines may not be suitable for seniors who have comorbidities, multiple morbidities, and therefore we will have to decide which vaccines are suitable for which segment. And we also, and that is one reason why we have set up this expert committee to advise us, looking at the data that's available on these vaccines and to decide whether they are safe for us to use and for which particular segment of population and how many doses do we need for that. And even if we were to apply these vaccines, it will also be progressive because it's not possible to vaccinate the whole nation in one go, and because the rest of the world also needs it. So I think that's why we have participated in the COVAX facility to allow us to have early access to the vaccine, and therefore we will look at how we can prioritize them. And as mentioned earlier as well, previously, that the most likely priority is likely to focus first on the healthcare workers who are in the front line, who are likely to be more exposed. So I think they would get the first priority to be vaccinated. And if the vaccines are suitable, then we will consider the more vulnerable groups like the seniors, who are more likely to develop severe diseases as a result of the infection. And therefore, we hope to be able to protect them, but that's provided that the vaccines are suitable for the seniors. So there are multiple factors to be considered, and that is why we are setting up this expert committee to be able to do a comprehensive analysis and assessment and to recommend to the government so that we can respond accordingly. Even with the availability of vaccine, we probably will not be able to vaccinate or do not intend to vaccinate the entire population, depending on the nature of the vaccine. And even if we were to vaccinate the entire population, it will take time to do so. In the meantime, it is important to continue to ensure that our safe distancing measure, our precautionary measures are in place, and we continue to observe personal hygiene and so on. This will help us to reduce the overall infection rate in Singapore. And as the infection rates are lower, we also have to take that into account. Then the urgency to vaccinate everyone will also have to take into account that the current infection rate in Singapore is at a very low level. And therefore, it's important for us to continue to ensure that we observe the safe distancing measure. And it's also important to bear in mind that we still do not have sufficient data as to the sustainability of the immunity that these vaccines may confer. So we will still need to establish the fact to allow us to have confidence that they are going to provide us lasting immunity. Because otherwise, we will continue to have to either revaccinate the population or we have to continue with our safe distancing measures. So I think in the meantime, it's important for us to continue to focus on our safe distancing measures and safe management measures to allow us to sail towards phase 3 in a safe way.